Hi everyone, this is Nurse Anna from nursestudy.net, and today we're going to be doing endocrine disorders, nursing NCLEX questions. This is 75 questions. Enjoy.
Would you like free audiobooks? Click the link in the description. Question 1. A patient with Addison's disease presents with profound fatigue, dehydration, hypotension, and hyperpigmentation. What is the most critical initial nursing action? A. Administering IV fluids. B. Checking blood glucose levels. C. Providing oral corticosteroids. D. Preparing the patient for a CT scan. Answer: A. Administering IV fluids. Rationale: in Addison's disease, patients can experience an adrenal crisis, which is a life-threatening condition that requires immediate fluid resuscitation to correct hypotension and dehydration. Administering IV fluids is the priority to stabilize the patient's hemodynamic status. Question 2. A patient with hyperthyroidism is being treated with radioactive iodine therapy. What is the most important nursing action to monitor during the first 24 hours after treatment? A. Assessing for signs of hypothyroidism. B. Monitoring for thyroid storm. C. Evaluating renal function. D. Checking for symptoms of infection. Answer: B. Monitoring for thyroid storm. Rationale: radioactive iodine therapy can cause a sudden release of thyroid hormones, leading to a thyroid storm, a life-threatening condition. Monitoring for symptoms such as fever, tachycardia, and altered mental status is crucial during the first 24 hours post-treatment. Question 3. A patient with Cushing syndrome is scheduled for a pituitary tumor removal. What preoperative teaching is essential for this patient? A. Expecting temporary vision changes. B. Understanding the need for lifelong steroid replacement. C. Knowing the signs of infection. D. Learning to manage postoperative diabetes insipidus. Answer: B. Understanding the need for lifelong steroid replacement. Rationale: patients with Cushing syndrome undergoing pituitary tumor removal may experience a drop in endogenous cortisol production postoperatively. They must understand the need for lifelong steroid replacement therapy to prevent adrenal insufficiency. Question 4. A patient with type 1 diabetes is experiencing diabetic ketoacidosis, DKA. What is the nurse's priority intervention? A. Administering insulin intravenously. B. Giving oral hypoglycemic agents. C. Providing a high-calorie diet. D. Encouraging increased fluid intake. Answer: A. Administering insulin intravenously. Rationale: in DKA, insulin administration is critical to lower blood glucose levels and stop ketone production. IV insulin allows for rapid control of hyperglycemia and ketonemia, which are essential for stabilizing the patient. Question 5. A patient with hyperparathyroidism is admitted with severe hypercalcemia. What is the most appropriate nursing intervention? A. Administering calcitonin. B. Providing vitamin D supplements. C. Restricting fluid intake. D. Encouraging bed rest. Answer: A. Administering calcitonin. Rationale: calcitonin helps lower serum calcium levels by inhibiting bone resorption and increasing renal calcium excretion. It is an appropriate intervention for severe hypercalcemia associated with hyperparathyroidism. Question 6. A patient with newly diagnosed hypothyroidism is started on levothyroxine. What instruction should the nurse emphasize? A. Take the medication with meals. B. Avoid all dairy products. C. Monitor for signs of hyperthyroidism. D. Increase fluid intake to 3 liters per day. Answer: C. Monitor for signs of hyperthyroidism. Rationale: patients on levothyroxine should be educated about the signs of hyperthyroidism, e.g., tachycardia, heat intolerance, as the medication dosage may need adjustment if these symptoms occur. Question 7. A patient with Pheochromocytoma presents with a severe headache and high blood pressure. What is the nurse's priority action? A. Administering beta blockers. B. Preparing for immediate surgery. C. Providing IV fluids. D. Ensuring a calm environment. Answer: D. Ensuring a calm environment. Rationale: in pheochromocytoma, stress and stimulation can precipitate hypertensive crises. Ensuring a calm environment helps prevent exacerbation of symptoms while preparing for further interventions such as medication administration. Question 8. A patient with diabetes insipidus, DI, is receiving desmopressin. What should the nurse monitor to assess the medication's effectiveness? A. Serum potassium levels. B. Urine output and specific gravity. C. Blood glucose levels. D. Respiratory rate. Answer: B. Urine output and specific gravity. Rationale: desmopressin is used to reduce urine output and increase urine concentration in DI. Monitoring urine output and specific gravity provides direct information on the medication's effectiveness. Question 9. A patient with SIADH, syndrome of inappropriate antidiuretic hormone, presents with hyponatremia. What is the most appropriate nursing intervention? A. Administering a loop diuretic. B. Restricting fluid intake. C. Providing high-sodium foods. D. Encouraging oral fluid intake. Answer: B. Restricting fluid intake. Rationale: in SIADH, fluid restriction is crucial to manage hyponatremia by reducing water retention and preventing further dilution of serum sodium levels. Question 10. A patient with acromegaly is being evaluated for transsphenoidal hypophysectomy. What preoperative assessment is crucial? A. Checking electrolyte levels. B. Assessing visual fields. C. Monitoring thyroid function. D. Evaluating cardiac enzymes. Answer: B. Assessing visual fields. Rationale: acromegaly often involves a pituitary adenoma that can compress the optic chiasm, leading to visual field defects. Preoperative assessment of visual fields is essential to document baseline function and plan surgical approach. Question 11. A patient with hypoparathyroidism has been prescribed calcium and vitamin D supplements. What complication should the nurse monitor for? A. Hypercalcemia. B. Hypokalemia. C. Hyperphosphatemia. D. Hyponatremia. Answer: A. Hypercalcemia. Rationale: calcium and vitamin D supplements can cause hypercalcemia if taken in excess. Monitoring serum calcium levels helps prevent complications associated with hypercalcemia. Question 12. A patient with hyperaldosteronism is experiencing muscle weakness and fatigue. What electrolyte imbalance is most likely responsible for these symptoms? A. Hyperkalemia. B. Hyponatremia. C. Hypocalcemia. D. Hypokalemia. Answer: D. Hypokalemia. Rationale: hyperaldosteronism leads to excessive potassium excretion, causing hypokalemia. Muscle weakness and fatigue are common symptoms of hypokalemia that need to be addressed promptly. Question 13. A patient with a thyroidectomy is being monitored for complications. What is the most critical sign to watch for postoperatively? A. Hypocalcemia. B. Hypercalemia. C. Hypoglycemia. D. Hypernatremia. Answer: A. Hypocalcemia. Rationale: hypocalcemia can occur if the parathyroid glands are inadvertently damaged or removed during thyroidectomy. Monitoring for signs such as tetany, tingling, and Chvostek's sign is essential. Question 14. A patient with Graves' disease is prescribed methimazole. What adverse effect should the nurse educate the patient to report immediately? A. Increased appetite. B. Weight gain. C. Sore throat and fever. D. Dry skin. Answer: C. Sore throat and fever. Rationale: methimazole can cause agranulocytosis, a serious condition characterized by a decrease in white blood cells. Symptoms like sore throat and fever indicate possible infection and should be reported immediately. Question 15. A patient with chronic kidney disease, CKD, has secondary hyperparathyroidism. What is the primary cause of this condition? A. Elevated serum phosphorus levels. B. Decreased serum calcium levels. C. Increased vitamin D synthesis. D. Excessive dietary calcium intake. Answer: B. Decreased serum calcium levels. Rationale: in CKD, impaired kidney function leads to decreased activation of vitamin D, resulting in lower calcium absorption from the gut and subsequent secondary hyperparathyroidism. Question 16. A patient with diabetes mellitus is experiencing diabetic neuropathy. What is the most important nursing intervention to prevent complications? A. Administering analgesics. B. Teaching foot care practices. C. Encouraging increased protein intake. D. Providing high-fiber diet. Answer: B. Teaching foot care practices. Rationale: diabetic neuropathy increases the risk of foot ulcers and infections due to reduced sensation. Educating patients on proper foot care practices is crucial to prevent complications. Question 17. A patient with primary aldosteronism presents with hypertension and hypokalemia. What diagnostic test is most likely to be ordered? A. Serum aldosterone level. B. Serum cortisol level. C. Thyroid function test. D. Plasma renin activity. Answer: A. Serum aldosterone level. Rationale: primary aldosteronism involves excessive production of aldosterone, leading to hypertension and hypokalemia. Measuring serum aldosterone levels helps confirm the diagnosis. Question 18. A patient with Hashimoto's thyroiditis is experiencing weight gain, fatigue, and depression. What lab result is most indicative of this condition? A. Elevated TSH. B. Decreased TSH. C. Elevated T3 and T4. D. Normal T3 and T4. Answer: A. Elevated TSH. Rationale: Hashimoto's thyroiditis causes hypothyroidism, characterized by elevated TSH levels due to decreased thyroid hormone production. The pituitary gland releases more TSH to stimulate the thyroid gland. Question 19. A patient with hypercalcemia of malignancy is receiving IV bisphosphonates. What is the primary action of this medication? A. Increasing renal calcium excretion. B. Inhibiting bone resorption. C. Enhancing gastrointestinal calcium absorption. D. Reducing parathyroid hormone secretion. Answer B. Inhibiting bone resorption. Rationale. IV bisphosphonates help manage hypercalcemia of malignancy by inhibiting osteoclast activity and reducing bone resorption, thereby lowering serum calcium levels. Question 20. A patient with hyperglycemic hyperosmolar state, HHS, has a blood glucose level of 850 mg per deciliter. What is the most critical initial nursing intervention? A. Administering IV insulin. B. Providing oral fluids. C. Administering glucagon. D. Giving potassium supplements. Answer A. Administering IV insulin. Rationale. In HHS, IV insulin is essential to lower the extremely high blood glucose levels. This intervention helps stabilize the patient by reducing hyperosmolarity and preventing further complications. Question 21. A patient with hypoglycemia is unconscious. What is the most appropriate nursing action? A. Administering IV dextrose. B. Giving oral glucose tablets. C. Providing a high-protein snack. D. Encouraging fluid intake. Answer A. Administering IV dextrose. Rationale. For an unconscious patient with hypoglycemia, IV dextrose is the fastest and most effective way to increase blood glucose levels and prevent further complications. Question 22. A patient with Hypopituitarism is experiencing fatigue, weakness, and hypotension. What hormone replacement therapy is most likely needed? A. Insulin. B. Corticosteroids. C. Antidiuretic hormone ADH. D. Thyroid hormone. Answer B. Corticosteroids. Rationale. Hypopituitarism can lead to adrenal insufficiency due to reduced ACTH production. Corticosteroid replacement therapy is necessary to manage symptoms like fatigue, weakness, and hypotension. Question 23. A patient with hyperthyroidism is undergoing thyroidectomy. What is a critical postoperative nursing assessment? A. Monitoring for hypoglycemia. B. Checking for respiratory distress. C. Evaluating for hyperkalemia. D. Assessing for bradycardia. Answer B. Checking for respiratory distress. Rationale. Post-thyroidectomy, there is a risk of airway obstruction due to swelling or hematoma formation. Monitoring for respiratory distress is crucial to ensure prompt intervention if needed. Question 24. A patient with diabetes is on an insulin pump. What is a key benefit of using an insulin pump compared to multiple daily injections? A. Reduced risk of hypoglycemia. B. Improved glycemic control. C. Lower insulin doses required. D. Decreased need for blood glucose monitoring. Answer B. Improved glycemic control. Rationale. Insulin pumps provide continuous insulin delivery, allowing for better glycemic control and flexibility in managing blood glucose levels compared to multiple daily injections. Question 25. A patient with congenital adrenal hyperplasia, CAH, is experiencing salt wasting crisis. What is the most appropriate immediate treatment? A. Oral hydrocortisone. B. IV normal saline. C. Oral sodium supplements. D. Intramuscular glucagon. Answer B. IV normal saline. Rationale. In a salt-wasting crisis, rapid fluid replacement with IV normal saline is crucial to correct dehydration and hyponatremia, stabilizing the patient's condition. Question 26. A patient with primary hyperparathyroidism is scheduled for parathyroidectomy. What preoperative complication should the nurse monitor for? A. Hypocalcemia. B. Hypercalemia. C. Hypercalcemia. D. Hypophosphatemia. Answer: C. Hypercalcemia. Rationale: primary hyperparathyroidism causes elevated serum calcium levels. Monitoring for symptoms of hypercalcemia, such as nausea, vomiting, and confusion, is essential before surgery. Question 27. A patient with diabetic nephropathy is being educated on lifestyle modifications. What dietary recommendation is most appropriate? A. High protein diet. B. Low sodium diet. C. High potassium diet. D. Low carbohydrate diet. Answer: B. Low sodium diet. Rationale: a low sodium diet helps manage blood pressure and reduces the risk of further kidney damage in patients with diabetic nephropathy. Question 28. A patient with Addison's disease is experiencing an adrenal crisis. What medication is most critical to administer immediately? A. IV hydrocortisone. B. Oral prednisone. C. Subcutaneous insulin. D. Oral calcium. Answer: A. IV hydrocortisone. Rationale: in an adrenal crisis, rapid administration of IV hydrocortisone is essential to replace deficient cortisol levels and stabilize the patient. Question 29. A patient with hyperthyroidism is prescribed propranolol. What is the primary reason for this medication? A. Lowering blood glucose levels. B. Reducing thyroid hormone synthesis. C. Managing symptoms of anxiety. D. Controlling cardiovascular symptoms. Answer: D. Controlling cardiovascular symptoms. Rationale: propranolol is a beta blocker used to manage cardiovascular symptoms such as tachycardia and palpitations associated with hyperthyroidism. It does not directly affect thyroid hormone synthesis. Question 30. A patient with Hypopituitarism is being treated with growth hormone (GH) therapy. What is an important side effect to monitor for? A. Hypotension. B. Hyperglycemia. C. Bradycardia. D. Hypercalcemia. Answer: B. Hyperglycemia. Rationale: growth hormone therapy can increase blood glucose levels, leading to hyperglycemia. Monitoring blood glucose is essential to manage this potential side effect. Question 31. A patient with a history of thyroid cancer is undergoing radioactive iodine treatment. What is the most important precaution to take after receiving the treatment? A. Avoiding contact with pregnant women and children. B. Increasing fluid intake. C. Taking anti-nausea medication. D. Using sunscreen regularly. Answer: A. Avoiding contact with pregnant women and children. Rationale: after radioactive iodine treatment, patients can emit radiation and should avoid close contact with pregnant women and children to prevent radiation exposure. Question 32. A patient with acromegaly is being treated with octreotide. What is the primary action of this medication? A. Inhibiting growth hormone release. B. Increasing insulin secretion. C. Reducing bone resorption. D. Enhancing thyroid function. Answer: A. Inhibiting growth hormone release. Rationale: octreotide is a somatostatin analog that inhibits the release of growth hormone, helping manage symptoms of acromegaly. Question 33. A patient with primary hypothyroidism is being started on levothyroxine. What is a critical instruction regarding medication administration? A. Take with a high-fat meal. B. Take at bedtime. C. Take on an empty stomach. D. Take with calcium supplements. Answer. C. Take on an empty stomach. Rationale. Levothyroxine should be taken on an empty stomach, ideally 30 to 60 minutes before breakfast, to ensure optimal absorption and effectiveness. Question 34. A patient with insulinoma presents with hypoglycemia. What is the most appropriate nursing intervention? A. Administering IV glucose. B. Providing a high carbohydrate meal. C. Giving subcutaneous glucagon. D. Administering oral dextrose. Answer. A. Administering IV glucose. Rationale. In severe hypoglycemia, IV glucose is the fastest way to raise blood glucose levels and stabilize the patient. Question 35. A patient with secondary hyperparathyroidism is receiving phosphate binders. What is the primary purpose of this medication? A. Increasing calcium absorption. B. Reducing serum phosphate levels. C. Enhancing vitamin D synthesis. D. Lowering parathyroid hormone levels. Answer. B. Reducing serum phosphate levels. Rationale. Phosphate binders help manage secondary hyperparathyroidism by reducing serum phosphate levels, which in turn helps control parathyroid hormone levels. Question 36. A patient with a pituitary adenoma is experiencing headaches and visual disturbances. What is the most likely cause of these symptoms? A. Increased intracranial pressure. B. Hypercalcemia. C. Hypoglycemia. D. Hypotension. Answer. A. Increased intracranial pressure. Rationale. A pituitary adenoma can cause increased intracranial pressure due to the tumor's growth, leading to symptoms such as headaches and visual disturbances. Question 37. A patient with primary adrenal insufficiency is experiencing severe fatigue and weight loss. What lab finding is most indicative of this condition? A. Elevated serum sodium. B. Low serum potassium. C. Elevated serum cortisol. D. Low serum cortisol. Answer. D. Low serum cortisol. Rationale. Primary adrenal insufficiency, Addison's disease, is characterized by low serum cortisol levels due to adrenal gland dysfunction. Question 38. A patient with hyperthyroidism is being evaluated for radioactive iodine therapy. What is a key contraindication for this treatment? A. Pregnancy. B. Diabetes mellitus. C. Hypertension. D. Renal insufficiency. Answer. A. Pregnancy. Rationale. Radioactive iodine therapy is contraindicated in pregnancy due to the risk of fetal thyroid damage. Alternative treatments should be considered for pregnant patients. Question 39. A patient with congenital hypothyroidism is being treated with levothyroxine. What is the most important follow-up assessment? A. Serum calcium levels. B. Growth and development milestones. C. Renal function tests. D. Liver function tests. Answer. B. Growth and development milestones. Rationale. In congenital hypothyroidism, monitoring growth and development milestones is essential to ensure that the child is responding appropriately to levothyroxine therapy and achieving normal growth patterns. Question 40. A patient with a Pheochromocytoma is experiencing a hypertensive crisis. What medication is most appropriate to administer? A. Beta blockers. B. Calcium channel blockers. C. Alpha-adrenergic blockers. D. ACE inhibitors. Answer: C. Alpha-adrenergic blockers. Rationale: alpha-adrenergic blockers are the first-line treatment for hypertensive crises in pheochromocytoma, as they help control blood pressure by blocking the effects of catecholamines. Question 41. A patient with hyperglycemia is being treated with insulin. What is the nurse's priority action to prevent complications? A. Monitoring blood glucose levels. B. Encouraging high-protein diet. C. Assessing for signs of hypoglycemia. D. Administering oral glucose tablets. Answer: A. Monitoring blood glucose levels. Rationale: regular monitoring of blood glucose levels is crucial to adjust insulin doses appropriately and prevent complications such as hypoglycemia or hyperglycemia. Question 42. A patient with hypoparathyroidism is experiencing muscle cramps and tetany. What electrolyte imbalance is most likely causing these symptoms? A. Hyperkalemia. B. Hypocalcemia. C. Hypernatremia. D. Hypophosphatemia. Answer: B. Hypocalcemia. Rationale: hypoparathyroidism leads to decreased production of parathyroid hormone, resulting in hypocalcemia. Symptoms like muscle cramps and tetany are common manifestations of low calcium levels. Question 43. A patient with Cushing syndrome is at increased risk for infections. What is the primary reason for this increased risk? A. Elevated blood glucose levels. B. Increased cortisol levels. C. Decreased white blood cell count. D. Enhanced inflammatory response. Answer: B. Increased cortisol levels. Rationale: in Cushing syndrome, elevated cortisol levels suppress the immune system, increasing the risk of infections. Cortisol inhibits various immune functions, making the body more susceptible to pathogens. Question 44. A patient with acromegaly is undergoing transphenydoid surgery. What is a critical postoperative nursing intervention? A. Monitoring for cerebrospinal fluid (CSF) leakage. B. Assessing for hyperglycemia. C. Providing high-calorie diet. D. Encouraging early ambulation. Answer: A. Monitoring for cerebrospinal fluid (CSF) leakage. Rationale: after transphenydoid surgery, there is a risk of CSF leakage due to the proximity of the surgical site to the brain. Monitoring for signs of CSF leakage, such as clear nasal drainage, is crucial for early detection and management. Question 45. A patient with hypercalcemia is receiving intravenous bisphosphonates. What is the primary action of bisphosphonates in this condition? A. Reducing calcium absorption from the intestines. B. Inhibiting osteoclast activity. C. Enhancing renal calcium excretion. D. Increasing parathyroid hormone secretion. Answer: B. Inhibiting osteoclast activity. Rationale: bisphosphonates inhibit osteoclast activity, reducing bone resorption and thereby lowering serum calcium levels. This action is beneficial in managing hypercalcemia. Question 46. A patient with Graves' disease is experiencing exophthalmos. What is the most appropriate nursing intervention to manage this symptom? A. Administering corticosteroids. B. Providing artificial tears. C. Encouraging use of sunglasses. D. Elevating the head of the bed. Answer. B. Providing artificial tears. Rationale. Exophthalmos, or bulging eyes, can cause dryness and irritation. Providing artificial tears helps lubricate the eyes and alleviate discomfort associated with this symptom of Graves' disease. Question 47. A patient with diabetes insipidus, DI, is experiencing excessive urination and thirst. What is the most important nursing intervention? A. Restricting fluid intake. B. Administering desmopressin, DAP. C. Providing a low-sodium diet. D. Encouraging high-protein diet. Answer. B. Administering desmopressin. Rationale. Desmopressin is the treatment of choice for diabetes insipidus, as it helps reduce urine output and manage excessive thirst by replacing the deficient antidiuretic hormone. Question 48. A patient with hypothyroidism is prescribed levothyroxine. What lab test is most important to monitor during treatment? A. Serum calcium levels. B. Serum TSH levels. C. Serum potassium levels. D. Serum glucose levels. Answer. B. Serum TSH levels. Rationale. Monitoring serum TSH levels helps assess the effectiveness of levothyroxine therapy and ensure that the dosage is appropriate for managing hypothyroidism. Question 49. A patient with Cushing syndrome is experiencing hyperglycemia. What is the primary cause of this condition? A. Increased cortisol levels. B. Reduced insulin sensitivity. C. Elevated aldosterone levels. D. Decreased thyroid hormone levels. Answer. A. Increased cortisol levels. Rationale. In Cushing syndrome, elevated cortisol levels contribute to hyperglycemia by promoting gluconeogenesis and reducing insulin sensitivity, leading to increased blood glucose levels. Question 50. A patient with hyperparathyroidism is experiencing bone pain and fractures. What is the most likely cause of these symptoms? A. Elevated serum calcium levels. B. Decreased serum phosphate levels. C. Increased bone resorption. D. Reduced vitamin D levels. Answer. C. Increased bone resorption. Rationale. Hyperparathyroidism increases parathyroid hormone levels, which stimulate bone resorption, leading to bone pain and fractures due to weakened bone structure. Question 51. A patient with diabetes is prescribed an insulin regimen. What is the most important teaching point to prevent hypoglycemia? A. Administering insulin before meals. B. Eating regular meals and snacks. C. Monitoring blood glucose once daily. D. Reducing physical activity. Answer. B. Eating regular meals and snacks. Rationale. To prevent hypoglycemia, it is essential for patients on insulin to eat regular meals and snacks to maintain stable blood glucose levels and avoid insulin-induced hypoglycemia. Question 52. A patient with Hashimoto's thyroiditis is experiencing weight gain, cold intolerance, and depression. What lab test is most indicative of this condition? A. Serum TSH levels. B. Serum calcium levels. C. Serum glucose levels. D. Serum sodium levels. Answer. A. Serum TSH levels. Rationale. Hashimoto's thyroiditis, an autoimmune condition causing hypothyroidism, is indicated by elevated serum TSH levels as the pituitary gland attempts to stimulate the underactive thyroid. Question 53. A patient with acromegaly is being treated with pegvisomant. What is the primary action of this medication? A. Inhibiting growth hormone release. B. Blocking growth hormone receptors. C. Increasing insulin secretion. D. Reducing bone resorption. Answer: B. Blocking growth hormone receptors. Rationale: Pegvisomant is a growth hormone receptor antagonist that blocks the effects of excess growth hormone, helping to manage symptoms of acromegaly. Question 54. A patient with diabetic ketoacidosis, DKA, is receiving insulin therapy. What is the most critical electrolyte to monitor during treatment? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Answer: B. Potassium. Rationale: Insulin therapy in DKA can cause a shift of potassium into cells, leading to hypokalemia. Monitoring potassium levels is crucial to prevent life-threatening arrhythmias. Question 55. A patient with Pheochromocytoma is being prepared for surgery. What is the primary preoperative medication to manage blood pressure? A. Beta blockers. B. Calcium channel blockers. C. Alpha-adrenergic blockers. D. ACE inhibitors. Answer: C. Alpha-adrenergic blockers. Rationale: Alpha-adrenergic blockers are used preoperatively to control blood pressure in patients with pheochromocytoma by blocking the effects of excess catecholamines. Question 56. A patient with hyperthyroidism is prescribed methimazole. What is an important adverse effect to monitor for? A. Hepatotoxicity. B. Nephrotoxicity. C. Agranulocytosis. D. Hypercalemia. Answer: C. Agranulocytosis. Rationale: Methimazole can cause agranulocytosis, a serious condition characterized by a dangerously low white blood cell count. Monitoring for signs of infection is essential. Question 57. A patient with diabetes insipidus is experiencing dehydration. What is the most appropriate nursing intervention? A. Restricting fluid intake. B. Administering desmopressin. C. Providing high-protein diet. D. Encouraging physical activity. Answer: B. Administering desmopressin. Rationale: Desmopressin is the treatment of choice for diabetes insipidus, as it helps reduce urine output and manage dehydration by replacing the deficient antidiuretic hormone, ADH. Question 58. A patient with hypothyroidism is being treated with levothyroxine. What is the most important teaching point regarding medication adherence? A. Take with a high-fat meal. B. Take at the same time every day. C. Take with calcium supplements. D. Take at bedtime. Answer: B. Take at the same time every day. Rationale: Consistency in taking levothyroxine at the same time every day ensures stable thyroid hormone levels and optimal management of hypothyroidism. Question 59. A patient with Cushing syndrome is experiencing weight gain and moon face. What is the underlying cause of these symptoms? A. Elevated cortisol levels. B. Increased insulin resistance. C. Decreased aldosterone levels. D. Reduced thyroid hormone levels. Answer: A. Elevated cortisol levels. Rationale: Cushing syndrome is characterized by elevated cortisol levels, leading to weight gain, moon face, and other symptoms due to the catabolic effects of cortisol on tissues. Question 60. A patient with hyperparathyroidism is scheduled for parathyroidectomy. What is the primary postoperative complication to monitor for? A. Hyperkalemia. B. Hypocalcemia. C. Hypernatremia. D. Hypoglycemia. Answer: B. Hypocalcemia. Rationale: post-parathyroidectomy, there is a risk of hypocalcemia due to reduced parathyroid hormone levels. Monitoring for symptoms such as tetany and tingling is essential. Question 61. A patient with diabetes mellitus is experiencing nephropathy. What is the most important nursing intervention to slow the progression of this complication? A. Administering ACE inhibitors. B. Providing a high-protein diet. C. Encouraging high-sodium diet. D. Administering corticosteroids. Answer: A. Administering ACE inhibitors. Rationale: ACE inhibitors help protect renal function by reducing blood pressure and proteinuria, slowing the progression of diabetic nephropathy. Question 62. A patient with Addison's disease is experiencing nausea, vomiting, and abdominal pain. What is the most likely cause of these symptoms? A. Adrenal crisis. B. Hypercalcemia. C. Hypokalemia. D. Hypoglycemia. Answer: A. Adrenal crisis. Rationale: nausea, vomiting, and abdominal pain are common symptoms of an adrenal crisis, a life-threatening condition that requires immediate medical attention and corticosteroid replacement. Question 63. A patient with hyperthyroidism is experiencing tachycardia and palpitations. What medication is most appropriate to manage these symptoms? A. Beta blockers. B. Calcium channel blockers. C. Alpha-adrenergic blockers. D. ACE inhibitors. Answer: A. Beta blockers. Rationale: beta blockers are effective in managing cardiovascular symptoms such as tachycardia and palpitations associated with hyperthyroidism by blocking the effects of excess thyroid hormones. Question 64. A patient with Hypopituitarism is experiencing fatigue and muscle weakness. What hormone replacement therapy is most likely needed? A. Insulin. B. Corticosteroids. C. Antidiuretic hormone ADH. D. Thyroid hormone. Answer: B. Corticosteroids. Rationale: hypopituitarism can lead to adrenal insufficiency due to reduced ACTH production. Corticosteroid replacement therapy is necessary to manage symptoms like fatigue and muscle weakness. Question 65. A patient with hyperglycemic hyperosmolar state, HHS, has a blood glucose level of 900 mg per deciliter. What is the nurse's priority intervention? A. Administering IV insulin. B. Providing oral fluids. C. Administering glucagon. D. Giving potassium supplements. Answer: A. Administering IV insulin. Rationale: in HHS, IV insulin is essential to lower the extremely high blood glucose levels. This intervention helps stabilize the patient by reducing hyperosmolarity and preventing further complications. Question 66. A patient with hypoglycemia is unconscious. What is the most appropriate nursing action? A. Administering IV dextrose. B. Giving oral glucose tablets. C. Providing a high-protein snack. D. Encouraging fluid intake. Answer: A. Administering IV dextrose. Rationale: for an unconscious patient with hypoglycemia, IV dextrose is the fastest and most effective way to increase blood glucose levels and prevent further complications. Question 67. A patient with hyperparathyroidism is experiencing severe hypercalcemia. What is the most appropriate nursing intervention? A. Administering calcitonin. B. Providing vitamin D supplements. C. Restricting fluid intake. D. Encouraging bed rest. Answer: A. Administering calcitonin. Rationale: calcitonin helps lower serum calcium levels by inhibiting bone resorption and increasing renal calcium excretion. It is an appropriate intervention for severe hypercalcemia associated with hyperparathyroidism. Question 68. A patient with thyroidectomy is being monitored for complications. What is the most critical sign to watch for postoperatively? A. Hypocalcemia. B. Hyperkalemia. C. Hypoglycemia. D. Hypernatremia. Answer: A. Hypocalcemia. Rationale: hypocalcemia can occur if the parathyroid glands are inadvertently damaged or removed during thyroidectomy. Monitoring for signs such as tetany, tingling, and Chvostek's sign is essential. Question 69. A patient with Graves' disease is prescribed methimazole. What adverse effect should the nurse educate the patient to report immediately? A. Increased appetite. B. Weight gain. C. Sore throat and fever. D. Dry skin. Answer: C. Sore throat and fever. Rationale: methimazole can cause agranulocytosis, a serious condition characterized by a decrease in white blood cells. Symptoms like sore throat and fever indicate possible infection and should be reported immediately. Question 70. A patient with primary aldosteronism presents with hypertension and hypokalemia. What diagnostic test is most likely to be ordered? A. Serum aldosterone level. B. Serum cortisol level. C. Thyroid function test. D. Plasma renin activity. Answer: A. Serum aldosterone level. Rationale: primary aldosteronism involves excessive production of aldosterone, leading to hypertension and hypokalemia. Measuring serum aldosterone levels helps confirm the diagnosis. Question 71. A patient with Hashimoto's thyroiditis is experiencing weight gain, fatigue, and depression. What lab result is most indicative of this condition? A. Elevated TSH. B. Decreased TSH. C. Elevated T3 and T4. D. Normal T3 and T4. Answer: A. Elevated TSH. Rationale: Hashimoto's thyroiditis causes hypothyroidism, characterized by elevated TSH levels due to decreased thyroid hormone production. The pituitary gland releases more TSH to stimulate the thyroid gland. Question 72. A patient with hypercalcemia of malignancy is receiving IV bisphosphonates. What is the primary action of this medication? A. Increasing renal calcium excretion. B. Inhibiting bone resorption. C. Enhancing gastrointestinal calcium absorption. D. Reducing parathyroid hormone secretion. Answer: B. Inhibiting bone resorption. Rationale: IV bisphosphonates help manage hypercalcemia of malignancy by inhibiting osteoclast activity and reducing bone resorption, thereby lowering serum calcium levels. Question 73. A patient with hyperglycemic hyperosmolar state, HHS, has a blood glucose level of 850 mg per deciliter. What is the most critical initial nursing intervention? A. Administering IV insulin. B. Providing oral fluids. C. Administering glucagon. D. Giving potassium supplements. Answer: A. Administering IV insulin. Rationale: in HHS, IV insulin is essential to lower the extremely high blood glucose levels. This intervention helps stabilize the patient by reducing hyperosmolarity and preventing further complications. Question 74. A patient with hypoglycemia is unconscious. What is the most appropriate nursing action? A. Administering IV dextrose. B. Giving oral glucose tablets. C. Providing a high-protein snack. D. Encouraging fluid intake. Answer: A. Administering IV dextrose. Rationale: for an unconscious patient with hypoglycemia, IV dextrose is the fastest and most effective way to increase blood glucose levels and prevent further complications. Question 75. A patient with hyperparathyroidism is experiencing severe hypercalcemia. What is the most appropriate nursing intervention? A. Administering calcitonin. B. Providing vitamin D supplements. C. Restricting fluid intake. D. Encouraging bed rest. Answer: A. Administering calcitonin. Rationale: calcitonin helps lower serum calcium levels by inhibiting bone resorption and increasing renal calcium excretion. It is an appropriate intervention for severe hypercalcemia associated with hyperparathyroidism.